Smiling is infectious. Yes, it's true.
I'm Dr. Kenny Levine with Health Talk. Seen on the web at wyw19.com on Universe. I'm here with Dr. Geronemus. Richard, we left last segment talking about oral cancer. You know, April, I'm sure you know, is Oral Cancer Awareness Month. You and I have instruments that look for oral cancer. I have one, you have a different one. Oral cancer is a very, very aggressive and deadly disease. I have a brother-in-law who lost part of his tongue because of it. We were at a meeting together where this young doctor got up and talked about how wonderful his life was, and one day he couldn't button the collar on his shirt, and he ended up having oral cancer on the base of his tongue and also in his neck. And the 5-year survival rate, if left untreated, is very, very disappointing.
But the 5-year survival rate of early detection is very encouraging, and that's why you and I are one of the few that have a special light that helps us see different types of circulation that are clues to a tumor developing. I don't believe in the rinses and the dyes to determine if something's already there, is it malignant or not. My feeling is if something is there, that doesn't belong, you take it out.
Absolutely.
You know, so there are early good statistics. You procrastinate, you're in trouble.
Let's talk a little bit about restorative dentistry now. We talked how things are less invasive, more conservative from your end. You're drilling less tooth than you used to have to drill.
Absolutely.
In your career now, as the generations get older, are you seeing less decay or more decay?
Well, when you take care of a population that varies from 20s to 100, or even 100, you know, you see the effects of different phases of their life. And I think that the younger age groups from 30 to 50 are very, very conscious of their smile, their dental health. It's a major factor with them in getting promotions, in selling a product, in being respected. There'd be nothing worse than having a bad mouth and trying to sell a product, because it's a distraction and it makes you look older, and in this time, economic times, you can't afford that. But unfortunately, the older we get and we're dealing with extended life, patients are on more medications, they age, the saliva dries, and they become they get more caries, they get more decay. And we have to deal, and we have a fine line, and it becomes very difficult. Do you decide what to do for that age of patients? You really have to say to them what the best dentistry is, and let them or their family decide, you know, what the good choices are. A bad choice, I won't give. There are a lot of other offices along the way that they can go to for that. But there's always several different good choices to take.
You know, people say, am I too old to do this? You know the story that my very first implants in 1985 were on Linda's 85-year-old grandfather. And Grandpa used those implants and improved the quality of his life for another probably 7, 8, 9 years. I have patients, I did a implant restoration for for the uncle of an orthodontist friend of mine. Uncle Nat was 87 years old when I did it.
It's a frame of mind.
A patient said to me, am I too old? And I have a cute answer. I said, well, if your physician tells you not to buy any green bananas, then maybe you're too old. But I agree with you. Quality of life is important. You know, in our society where we live in South Florida, eating is a big part of our social lives. You know, for us and for seniors. Unfortunately, a lot of our seniors are single now, and they're out dating, and they don't want the date to know that they don't have teeth. They don't want to be uncomfortable. They don't want to have excuses themselves to go up and clean out under a denture. So many times they want the best care possible for a long time, and for what might be considered an older individual.
But it's a mental set. If they want the best for themselves, they're going to live longer, because their mental set is to live longer, that it isn't their last day. On the other hand, You could take care of somebody in their mid-60s, and you know they're just not going to make it. Because their attitude is, I'm already 65.
Right.
You know, and it's really wonderful to see the attitude of the older patients being active and wanting the best for themselves.
By the way, 65 is kind of young.
65 is, is very young.
We'll be back. Dr. Kenny Levine with Health Talk. We'll see you in a minute. Thank you.